Hey, Dr. Lindsey here. Does smoking alter hair transplants? This is a thing I've been preaching on for 30 years and 23 days. And so in this video, I'm going to be seated and going through the cases individually. But smoking and nicotine, that includes dipping, vaping, chewing tobacco, really anything with nicotine. The effect of nicotine is it shrinks down blood vessels. Here's a blood vessel to this, and so you get less blood supply, and it's almost like you have diabetes or renal problems. You simply don't get enough blood to a wound, and so we try to make smokers quit for 3 weeks before and 3 weeks after a hair transplant. And I try to beat it into them. I tell them it's going to affect the results. And then some people, of course, get irritated with that. So, I went to Dr. So-and-so, and he said, well, you should go to Dr. So-and-so because I'm certain, but now I can show you at least anecdotally on these 5 or 6 patients what happens if you smoke. And so in this little video, by just happenstance, it's now July 23rd, about 3 weeks ago, we had a bunch of follow-ups all come in the same couple of days. And I looked back and they were all 6 months follow-ups, and we all were done within 9 days of one another. And Wendy and I were looking at them, and 4 of those 5 guys looked like they were about 7 or 8 months out from surgery. And one guy, and he's a pretty cool guy, he's come to see my band. He gave me some Christmas ornaments for the office. He's brought his kids to see my band. He's a super nice fellow. He didn't look quite as good. And I was thinking, and after he left, I went back through the chart, and I saw smoking. And I remember his wife was pregnant with their 4th kid, who should be born tomorrow. We got an office pool on when the kid's coming out. And his wife had been trying to get him to quit smoking for years. And so he had told me he quit smoking for vaping for 3 weeks before. I don't know whether he does or not. You never really know for sure. We've done blood tests in the past, but I've given up on that. And then at a week, he still said he wasn't vaping. And then I remember at a month, in fact, I wrote it down, that he smelled like cigarette smoke. Now, maybe he's hanging out with somebody that smoked. I don't really know. And then he came sometime in the middle of like 3 months out because he was kind of nervous. I didn't really think much of it. He was right on schedule. And then maybe a couple of days before I saw him back in the office, I was over at the Italian restaurant here in McLean, and I saw him without a hat for the first time I've ever seen him without a hat. And I remember telling my wife and my buddy, I said, it's starting to work, because when they finally take off the hat, there's some hair growing. And he was cordial, and he came over. And so he came into the office, and he looks okay. I mean, he's got bushy, wiry hair, and he's probably only half grown. But if you look at him compared to the other 4, it's definitely not quite as good at this point. Now, it could be patient variability. It could be, smoking. That's what I'm putting my money on. It could be my poor photography. It could be wearing the hat. It could be anything. I'm telling you, after 30 years and 23 days of doing this, and a couple of years doing head and neck cancer, where we really had to worry about blood supply, I'm pretty sure it's the smoking. And so I suspect he'll catch up mostly by 13 or 14 months with the other guys. But if you're gonna have a hair transplant with us, and I would say probably with anybody, I think your maximal chance of success is if you don't smoke forever, but at least 3 weeks before and 3 weeks after your surgery, until those trees have kind of taken root. Now onto the video. Okay, so now I'm going to go through all the cases. Generally, it's going to be the pre-op into surgery, day 6, a month, and 6 months. There might be an extra picture. I'll comment on it. Patient 1 is an Asian guy with brown hair and slightly finer than average hairs. And here is before. There's 2,500 grafts. This is at a week. He made it easy by letting us shave his head after that. A month, and it's 6 months. One with his hair pulled back by his own hand, one with that. And it's partly that he's got a good color match. But shoot, that looks like about a 10-month result to me. It looks awesome. Patient 2, 22-year-old guy from Africa. And we did 2,500 grafts on him. At the end of the case, he did great cleaning. This is at 1 month. It's fallen out, and he definitely looks operated upon there. And there's his 6 months. Again, he's got a good color match, but shoot, that looks a little more like 8 or 9 month result to me. Patient 3, 23-year-old college student. We did, and we just did maybe 2,000 grafts at the front. Might even be 1,800 at the front. Into the case, week, and then he did not come back until 6 months out. And this is him at 6 months. And now he's got a little more color contrast, but that also looks pretty good. It looks more like 8 or 9 months to me for an average person. Patient 4, 40-year-old, very anxious fellow, high IQ. 4, here's about 2,200 grafts. This is 1 month. He sent me not millions, but lots of pictures because he was concerned about redness, which really is a problem only for reddish complected people. This is 1 month. It's quite red. And here he is at 6 months. And this is a selfie taken at home. Again, I'm saying that doesn't look like a final result, but gosh, that looks 8, 9, 10 months out. I mean, it looks great. Lastly, the smoker. Here he is before. He's 40-ish-year-old guy. He's got really good hair story. I mean, there's no bushy hairs. It's hard to kill those hairs, conceivably, unless you smoke. This is the end of the case. 2,500 grafts or so. Good cleaning at a week. Here's a month. Here's 3 months. Not really much change. And then this is 6 months. And maybe it looks like a 6 month result. It's probably half grown. There's some space in there, but by contrast, he simply doesn't look as good as the other dudes. And I think it's probably because of the smoking. All of them were done by the same group of people, the same 2-week period of time during the year, did the same kind of cleaning, and followed all the rules. And if the smoker to come in first, I probably would have said, hey man, you look fine, and not thought any more of it. As it is, he came in 4th or 5th, and that's what made me think, man, that really doesn't look as good as the other guys. And so that's the impetus of this video. So to summarize, I'm virtually certain that the effect of nicotine on vasoconstriction or shrinking down blood vessels affects hair transplants. If you're adamant that it doesn't, it's probably in the office for you, because I'm certain that we get better results in people that don't smoke, and we ask you not to smoke for 3 weeks before, 3 weeks after. I ask you to not to smoke forever, but those are kind of the general rules here. I hope this video is educational. Whether you come here or not, I would like you to consider giving up smoking and at least do your surgeon the benefit of making the transplant as likely to succeed as possible.